Sunday is National HIV Testing Day, and right now Florida leading the nation in new cases. That's according to the CDC. What one local organization says is the key to combating that. Sunday is National HIV Testing Day. In 1981, the first cases of what would become known as AIDS were reported here in the U.S. Today, more than 1.2 million people in the country are living with HIV, with more than 35,000 new infections each year. Florida leads the nation in new cases, according to the CDC. But as 10 Tampa Bay's Jenny Dean shows us, it is good to know resources are available and testing is important.
And it takes the stigma away from it because it's the one day for the month of June that it's in the news. If you think about HIV in the news, it's not there so much anymore.
Joy Winheim is the executive director of EPIC, a Tampa Bay organization helping HIV patients for more than 30 years. She says an HIV diagnosis is no longer a death sentence, but she thinks that's why new cases are up.
We have made incredible advances in medicine. We've gone from 15 pills a day to 1 pill a day. It's a very manageable disease, and I think people are taking that as it's not so scary anymore.
Michael Tollar was diagnosed with HIV in the mid-'80s. It was especially tough in the early years.
Friends were dropping like flies. I mean, we had memorial services every week, and you just got really tired of releasing the balloons, and finally I just kind of closed up, and I didn't cry anymore.
Thanks to all the medical advances, Tollar has his HIV under control now, but says people should be tested more often.
Oh, they definitely should. I mean, back, in the 80s, it wasn't anything. We were just, lambs being led to slaughter,
Winheim says there's one thing people should know about HIV and AIDS.
It's 100% preventable. All you have to do is have safe sex, get on PrEP if you continue to have high-risk behaviors, and really the message for us is that we don't care what you do out there, we just want you to do it safely.
And the Florida Department of Health has come up with 4 ways to reduce HIV transmission and deaths. Steps include HIV and STI screenings and priority testing, providing rapid access to treatment, improving and promoting access to PrEP, and raising awareness through outreach, engagement, and messaging. Now, getting an HIV test may be a scary thought, but the staff at Metro Inclusive Health says that you can get a quick finger prick or a blood test for more complete results. We're getting a sharper insight into the importance of knowing and understanding your status and what your next steps would be after you get the test.
If you are HIV negative and you receive that test result, how can you keep yourself HIV negative? What preventative tools are available to you, such as pre-exposure prophylaxis or PrEP? And if you discover that you are living with HIV, then the most important thing to know is to get yourself into HIV medical care.
So how often should you be getting checked? Well, he adds if you are more sexually active in your life, they recommend maybe between 3 and 6 months, but at the very least once a year for screenings as part of your routine health checkups.